time I speak to a peripheral neuropathy patient, the conversation always starts the same way. First, they'll share with me everything that they've tried to combat their neuropathy that hasn't worked. They'll tell me they've tried gabapentin, Lyrica, nerve support supplements, infrared light devices, and electrical stimulation devices like TENS or the Rebuilder, and that nothing has worked. Well, here's an interesting fact. When we do an in-depth review of their lifestyle, we always find several things they're unaware of that are impairing the nerve's ability to heal. Once we identify and remove these roadblocks, then their nerves begin to heal at a much faster speed. So today, I'm going to share the 5 most common culprits that will sabotage your ability to recover from peripheral neuropathy. You don't want to miss this. Coming up. Hey gang, Dr. Valerie Montero here. If you're finally ready to conquer your peripheral neuropathy, reclaim your life, and start living again, then subscribe to our channel and don't forget to click on the bell so you're notified as soon as we publish new content. Now, let's dive into today's video. So, you may have heard me say in the past that nerves are the slowest healing tissues in your body and can take anywhere from 1 to 2 years to fully heal under the correct conditions. Now, as slow as that is under the right conditions, imagine what might happen to your nerve's ability to repair and regenerate with significant roadblocks bombarding the body. So I'm going to uncover the 5 biggest culprits that will sabotage your nerve recovery to help you maximize your nerve's healing potential. So let's start with number 5, vitamin D deficiency. 42% of the American population is deficient in vitamin D. This vitamin plays an enormous role in our bodies. We know it's necessary for healthy bones, but its role for overall health far exceeds this. Vitamin D can reduce cancer cell growth. It can help control infections and reduce inflammation. Along with that, it also improves our body's ability to absorb other nutrients like calcium, which is imperative for healthy functioning nerves. Also, did you know that a vitamin D deficiency is linked with the development of both type 1 and type 2 diabetes? Now, here's where it gets really interesting. This vitamin is crucial for nerve growth factors. This is a protein necessary for the development and survival of nerve cells, especially the ones that transmit pain, temperature, and touch sensations. Also, low levels of vitamin D prevent the peripheral nerves from conducting the proper signals and at the proper speeds, leading to dysfunction and damage of the nerves. Now, you might say, but I live in Texas, Arizona, California, Florida, or some other sunshine state or country, and I'm always outside, so I can't possibly be deficient in vitamin D. Well, think again, and get ready for a few important side notes. 1. People with darker colored skin tones, like myself, have a difficult time manufacturing vitamin D from sun exposure. This is because the melanin in our skin doesn't allow the absorption of as much UV radiation, which is mandatory for the production of vitamin D. The darker a person is, the less vitamin D that they'll be able to manufacture from sun exposure in their body. On the contrary, people with white skin tones can absorb quite a bit of UV radiation and can better produce this sunshine vitamin. 2. Also, you need to expose a sufficient amount of skin to sunlight to maintain healthy vitamin D blood levels. Notice I said maintain. If you're deficient already in vitamin D, sun exposure alone will not restore your levels back to normal. You'll need to take a good quality vitamin D supplement in order to accomplish this. So, if you're pretty much fully covered by clothing like long sleeves or pants while outdoors, guess what? You're blocking the UV penetration into the skin and you won't be manufacturing very much vitamin D. For sufficient levels of vitamin D production, you need to wear a tank top and shorts outside for 10 to 30 minutes at least 3 times per week. Now, If you're worried about skin cancer or burning, you can avoid this by not going into the sun during the hottest part of the day when the UV rays are the strongest, and by minimizing your sun time to maybe 10 to 15 minutes for a light-skinned person. For a darker skinned person, we need to spend anywhere between 30 minutes to 3 hours in the sun to allow for significant vitamin D production. The darker the tone of your skin, the closer you'll fall into the 3-hour mark. Number 3, using sunscreen. Well, there is conflicting research on this topic of whether or not sunscreen with an SPF of 30 or higher prevents vitamin D production. When I combed through the research, and there's a lot out there, I found that the majority of studies that said it won't interfere at all were biased. Yep, you guessed it. Many were funded by companies that produce sunscreen. Now, this happens frequently where research studies are tainted and biased. Whenever I encounter significantly conflicting studies, I have to use my head and go back into logical scientific thinking, meaning I begin to look at facts like, how does the sun help at manufacturing vitamin D? Well, let me give you the short version of this. When UVB light from the sun gets absorbed into the skin, it interacts with a specific protein called 7-DHC, which converts this into vitamin D3, the active form. Sunscreen with an SPF of 30 or higher blocks most, but not all, UVB rays. Well, let's just analyze the logic for a second, shall we? If we're blocking out most of the UVB rays, and don't forget, UVB rays are necessary for vitamin D production, wouldn't it make sense that most likely we won't make significant vitamin D production while wearing sunscreen? Well, I don't think it takes a rocket scientist to connect those dots, do you? So here's what you can do to protect your skin from burning while meeting your vitamin D needs. Spend the allotted time I just outlined in the sun early in the day. Set your timer. Bring your sunscreen with you, and when you've reached safe and sufficient sun exposure, then apply the sunscreen. Voila! Problem solved. It's important for you to know where your vitamin D levels are at. You can walk into any lab and get this testing done, and health insurance will cover it. If you don't have health insurance, don't worry. You can go into a place like Any Lab Tests Now or another type of walk-in lab where you don't need a script from your doctor, and you can get this lab test done for about $129. It's money well spent. Lab values list normal ranges as between 30 nanograms per milliliter to 100 nanograms per milliliter. Now, that's a pretty big range, between 30 to 100. In functional medicine, we always analyze what is the optimum level for the body to maintain to restore health. So for vitamin D, your optimum level should be between 60 to 100 nanograms per milliliter. Whenever I'm working with a patient that falls below 50, I always consider this deficient because I know how much vitamin D the body requires daily to restore health. So, if you were deficient, how much vitamin D should you take? Well, obviously, this depends on how deficient you are. For my patients, I always recommend they start with at least 10,000 IUs or 250 micrograms daily of vitamin D3. And I make sure that they take that with vitamin K2 to maximize the absorption and utilization. If their lab values are closer to 30 or below, I'll place them on 20,000 IUs for at least 90 to 120 days to get their levels back up to optimum. I'll leave a link for you down below for a good quality brand of vitamin D complex with K2 already in it. Moving on to number 4, diet. Now, I'm going to approach this from a few different angles. Obviously, I'm going to talk about processed foods, refined carbs, sugary beverages, and artificially sweetened beverages. Guys, there's just no getting around this, and the sooner you stop resisting this, the faster you'll head on the road to nerve recovery. But this time, I want you to have an understanding as to why or how this interferes with your recovery from peripheral neuropathy. When I use the term processed foods, I'm not just talking about fast food or junk food. I'm referring to anything that comes in bags, cans, jars, or boxes. This results in essential nutrients being stripped away during the processing methods. Although the manufacturer may add some nutrients, and the key word is some, back in, they put in synthetic and poor quality nutrients. Also, these foods are laden with sweeteners which cause insulin resistance, as well as artificial sweeteners. They include processed salt. Now, this isn't to be confused with healthy, good quality sea salt, which is abundant in trace minerals. And they'll also include artificial flavors. Wait, it gets worse. They usually have tons of hydrogenated fats, coloring, chemical emulsifiers, and chemical preservatives to make them look prettier, taste better, and last forever on the store shelf. So here's the problem. Aside from the fact that most of these chemicals are carcinogenic and a huge contributing factor to the escalating rates of cancer in children and adults, they are depleted of critical vitamins, minerals, and nutrients like B1, B3, B6, B12, folate, zinc, magnesium, and trace minerals that your nerves rely upon for repair and regeneration. So maybe you're thinking, well, no big deal because I'm taking a good quality nerve support formula and other mineral supplements, so I've got all these bases covered. Think again, because not only are processed foods deficient in critical nerve nutrients, but in order for your body to metabolize and neutralize their damaging effects, it will steal B vitamins and minerals from other areas. So that wonderful nerve support supplement you've been taking will get rerouted from going to the nerve cells, and instead it will be used to buffer all of the processed food that you just consumed. Guys, when working with neuropathy patients, I can't tell you how this will tremendously slow the healing process and create a roadblock. Now, remember, I said I was going to hit this from a few different angles. Well, the other thing I want to discuss is the obstacle of being either vegan or vegetarian. This is a much smaller percentage of the population, but we've still had vegans walk into our practice with peripheral neuropathy. Both vegans and vegetarians run a high risk of nutritional deficiencies of vitamin B12, vitamin A, vitamin D, vitamin E, omega-3 fatty acids, zinc, iron, and iodine. Vegans also run the increased risk of being deficient in vitamin B2, calcium, and selenium. Now, there's nothing wrong with being vegan or vegetarian. In fact, when it's observed properly, it has many health benefits for humans, animals, and the environment. By the way, I'm a vegetarian, so I understand firsthand the challenges of avoiding nutrient deficiencies. So it's important that we make certain that we're eating a wide enough variety of foods and also taking additional supplementation to compensate for these vitamins and minerals. Guys, eliminating processed foods from your diet is a real game changer in healing your peripheral nerves. Now, to be fair, do we have patients that eat like crap and refuse to change their diets but still recover? Yes, we do. However, I will tell you it's a longer and more difficult road to healing. So when they say to me, "Doc, I don't get it. It's been a year and I'm only 60% better." Well, without any judgment, because I know how powerful food addictions are. Hell, the processed food industry intentionally adds chemicals to make them addictive. I always remind them to look at what's on their plates. And if that's not going to change, then be patient because it's going to be a very slow ride. Okay, on to number 3, being a cave dweller. The average American spends more than 90% of their life indoors. We're turned into a nation of cave dwellers where we spend almost all of our time cooped up indoors, whether it's at the job or at home. And to make matters worse, when you're at home, most of the time you have the blinds closed with very little sunlight coming through. Well, being a cave dweller has profound effects on your nerve health. First of all, it contributes to low vitamin D levels. Secondly, as a cave dweller, you end up sitting most of the time, which leads to stagnant blood flow or decreased circulation. This decreases the amount of oxygen and nutrients delivered to the nerves that are vital for the nerve's well-being, not to mention their ability to heal. Third, being a cave dweller causes decreased serotonin levels, the hormone responsible for our sense of well-being, calm, and focus. In my video on rewiring the brain, I go into the importance of serotonin. I'll leave a link for you below so you can check it out now after this video. This hormone is extremely important in maintaining a positive attitude while you heal and preventing cortisol levels that raise inflammation from getting too high. And lastly, being a cave dweller will greatly interfere with your circadian rhythm, which will disrupt your quality of sleep. Sleep quality is instrumental in the healing process of your nerves and other cells of your body. So, how much time should you spend outside in nature? Scientific studies reveal that spending as little as 20 minutes outside in nature 3 times a week had an enormous physical and mental healing benefits. So get ready for a side note here, guys. People who spend this time in nature or outside and use their cell phone, whether talking or texting, saw none of these benefits. One last thing. The longer people spent in nature, for instance, 20 minutes every day or more, the more significant health benefits they received. So, as soon as you're finished watching this video, put down your phone or your tablet, walk away from your computer or TV, and get outside. And when you get there, don't forget to take a few deep breaths to flush out the stale air from your lungs and oxygenate your body. Okay. On to number 2, lack of exercise. Now, wait a minute before you throw a shoe at me because you're thinking, how insensitive of you. You know those of us that have severe neuropathy simply can't exercise. Okay, guys, I'm not talking about going out and running a marathon today or taking up Zumba. I'm talking about getting started with your neuropathy exercises. I filmed several videos for you to use. Don't worry, I'll include the links below, but I filmed a full-length 20-minute version, and for those who can't even do 10 minutes of exercise without the neuropathy getting worse, I broke down each exercise separately, so you can start with just 1 or 2 exercises that will take less than 5 minutes and won't flare you up. Being active can reduce your blood sugar, improve your blood flow to your nerves, and slow down nerve damage. It will also increase your endorphin release, which are your happy hormones that help decrease your pain levels. Okay, moving on to the number 1 culprit for sabotaging nerve repair. It's alcohol. Alcohol slows down nerve repair and in many cases can prevent it. Part of the reason is that it makes it more difficult for the body to absorb B vitamins, especially B1, B6, niacin, folate, and B12, which are critical for nerve function and nerve repair. Also, regular alcohol consumption decreases the effectiveness of insulin, leading to insulin resistance and elevated blood sugar levels. Another problem is that alcohol inhibits the function of neurons or nerves. It reduces their ability to transmit or fire electrical impulses to the brain. This can result in abnormal nerve communication, which gets misinterpreted as many of the different symptoms we see with peripheral neuropathy. Not to mention the fact that the breakdown of alcohol in the body results in a toxin that can cause direct damage to the nerves. So, how much alcohol is too much? Well, science has revealed that even people who drink 1 to 2 glasses of wine, beer, or other alcoholic beverages daily cause substantial damage to peripheral nerves. So let's look at this analogy. If there's a building that's on fire and the fire department is trying to put it out with their hoses, but you're on the other side of the building spraying gasoline into the fire, well, how effective do you think the fire department will be with extinguishing that fire? It's the same process for your nerves. if you're taking a nerve support formula and maybe even using photobiomodulation, but you're still consuming, let's say conservatively, even 3 to 4 beers a week, your body is still going to struggle to put out the fire and repair the damage. This will give you the largest setbacks. Well, gang, that's it for today. I hope I helped shed some light on things that may be interfering with your nerve recovery. Making these changes in your life can be a huge game changer in healing your peripheral nerves and finally being able to reclaim your life back. Thanks again for watching. If you've enjoyed our videos, the best way you can support us is by liking this video and sharing it with others. This really helps neuropathy sufferers know there's hope and they're not alone. Also, don't forget to subscribe to our channel and click on the bell to get notified as soon as we publish new videos. Until next time, my friends, I look forward to seeing you on the road to great nerve health. Blessings. Day-o, day-o, daylight come and we wanna go home. Okay, sorry.